So you may not have noticed when I walked on the stage here that I was walking into a minefield. And the reason I say it's a minefield because I'm going to talk to you today about healthcare. And in spite of all the medical miracles that we live with today, I'm pretty sure that almost everybody here has experienced some of the pain and frustration that comes along with modern healthcare. And people tend to have especially strong feelings when it comes to costs and insurance. So let me just ask you, how many here feel that you or your employer spend too much on healthcare costs? Yeah, just about everybody. Well, let me ask you this. How many of you expect that to get better anytime soon? Yeah, nobody's raised their hand. Well, I'm here today to tell you that there's reason for hope. Health technology is changing the world, and it's already making major differences. And I'm going to explain to you some of the ways that it's going to make a difference in your lives and our lives. So I'm Alfred Poor. I'm the health tech futurist. And I've spent my entire career evaluating technology and then explaining it to people so that they can put it to use. I started off in the personal computer revolution. I was in the front lines. I wrote for PC Magazine for more than 20 years. And after that, I moved to flat screen televisions, back when we were making the transition from analog to digital broadcasts, and people were very confused about what's plasma, what's LCD, what should I buy. And now, I help people understand wearable technology and mobile technology for health and medical applications. And I'm a graduate from Harvard College. I'm the author or co-author of more than a dozen books. And I have an international reputation as an expert technology speaker and writer. So we're living in an age of medical miracles. Digital health devices, 3D printing, smart garments, and telehealth are just a few of the technologies that are making a huge difference in people's lives today. Today I'm going to tell you just about 3 of the different areas where health technology is making a big difference in lives, among the many. But the main thing I want to do today is I want to change the way you think about healthcare and its future. Because the solution is going to come from technology, just as it did thousands of years ago in the days of the ancient Greeks. Why the ancient Greeks and healthcare? Well, back then, playwrights used to write plays, and sometimes they would get their heroes into these impossible situations that looked absolutely hopeless. And the way they solved the problem was they introduced a new character, a god, who would come in with special powers and solve the problem. Well, the way the gods got on stage is they would get lowered from the heavens by a crane that was off stage, and that led to the saying, Deus ex machina, which means God by machine. And I believe that our solution to our healthcare problems is going to come from machines, from technology. But the thing is, this is not some fiction in some play. This is reality. This is stuff that's already happening today and making differences in thousands and millions of lives right now. So the 3 topics that I'm going to talk about today, the first one is about chronic disease. Second one, I'm going to talk about the problems of aging in place. And the third topic is about health in the workplace. And for each of these, I'm going to talk a little bit about what's been happening in the past, what's happening now, and what you can expect to see in the near future. So we'll start off with the first topic, chronic disease. Now, you probably all know somebody who's coping with a chronic illness of some sort or another. People have high blood pressure, they have heart failure, they have breathing disorders, they have obesity and all the illnesses that can relate to that. And the fact is that health technology is helping with those already, and we're saving lives and saving billions of dollars a year. Let's take just one, for example, diabetes. Now, you can see I'm not working with any visuals today. So with your permission, I'd like to use you all as a human pie chart. So if you're able and comfortable doing so, I would like everybody in this section here to stand up for a second. Thank you. Now, you're about 1/10 of the total audience. You represent the people in the United States who have diabetes. So take a look around. That's a lot of people. Thanks. You can sit down. The American Diabetes Association says that there are about 30 million Americans with diabetes in this country. And it costs, on average, an extra $352 billion in healthcare costs. In addition to the direct healthcare costs of managing diabetes, there are also very expensive and life-altering complications that can arise, such as blindness or losing a limb to amputation. So it's a serious and expensive disease. Up until this point, for the most part, people manage it by sampling their blood, doing a finger stick multiple times a day. And then they measure their blood sugar and adjust the insulin dose that they need, and they inject themselves with the insulin they need. But the problem here is it's painful, it's uncomfortable, it's embarrassing. You're not going to want to do it in public in a lot of the cases. And you can't do it at night while you're asleep. And so the problem with this is that if you don't keep good track of your blood sugar levels can get dangerously high or low. But what's happening now is you can now get a thing called a continuous glucose meter. It's actually a wearable device that you put on, and the sensor measures your blood sugar levels constantly. And you can go for 10 days without having to change the sensor. And the big news is it can wirelessly send that data to another wearable device called an insulin pump. And the two devices can pair up to make sure that you're getting just the right amount of insulin that you need all through the day, all through the night. But it's going to get even better. They have come up with tiny sensors, smaller than a grain of rice, that can be put under your skin. And they constantly measure your blood sugar. And these devices can be left in for at least 6 months. And that limit is being extended more and more as they get more clinical experience with this stuff. So the fascinating thing here is that we're headed towards a future where diabetes will manage itself. Your blood sugar will be measured automatically, your insulin dose will be adjusted automatically, and the patient won't have to think about it at all. And by doing this, we're going to keep their blood sugar levels within a much tighter range, which eliminates all those complications like the blindness and the amputations, which is going to save hundreds of billions of dollars a year. And that's just diabetes. The second one I want to talk about is aging in place. Now, you all are aware that the average age of our population is getting older, and there are just not enough caregivers to go around to help the seniors who are getting older, and yet seniors desperately want to stay living in their own homes independently for as long as they can. Well, the problem is that seniors can develop impairments. They can be physical or they can be cognitive, and they can happen suddenly, like a fall or like stroke, or they can happen slowly over time, such as arthritis or dementia. And the problem is we need to track that, because if the impairment gets too severe, they're not going to be able to live independently without some help. Now, in the past, the only choice we had was to put an elderly person in a home, in a managed care facility, where professionals would take care of them. The problem with that, first of all, is it's hugely expensive compared to living at home. But the other problem is it ends up with a really much poorer quality of life for the individual. And so it would be better to find a way to solve that and not have to rely on the managed care. Now, there are some solutions in use today that are simple, but they're not always effective. Let me give you the example of my mother. She's 97 years old. She lives by herself in a single-family home with no immediate neighbors. Now, a few years ago, she decided that she wanted somebody to be able to check in on her, make sure that she was all right. So she enlisted a friend who lived locally to call her every morning. That lasted about 2 weeks. What happened was the phone calls quickly devolved into, "Hello, Sydney? Are you dead yet? No? Okay, I'll call you tomorrow." So they found this process so uncomfortable that they rapidly gave it up. Now, there are other devices and technology that can help. One of the most common is a thing called a personal emergency response system, a PERS. These are those pendants you've seen in those TV commercials about "help, I've fallen and I can't get up," right? And it's true, they save lives, they really make a difference, but for only a tiny fraction of the people who have them. Why? Seniors hate them. They refuse to wear them. They feel like it's a badge of shame. It makes them feel like you did when your mother would pin a note on your sweater for your kindergarten teacher. Yeah, so they don't like that. Well, fortunately, that's changing rapidly, and there's some very good solutions coming on the market right now. For example, there's a smart wall plug that you can plug into an outlet, and it uses invisible radio waves to detect if somebody's in the room. They can tell whether the person is standing up or if they're lying down. They can tell whether the person is moving or if they're still. And it can tell, soon these devices are going to have the feature where they can tell the breathing rate, whether somebody's breathing fast or slow or not at all. They even are going to be able to measure heartbeats. And so technology is going to make it easier, safer, more affordable for seniors to live independently in their home. We're going to save families a ton of money, and we're going to provide a lot more ease of mind for everybody involved. And so, for the third topic that I want to mention is health in the workplace. Now, up until now, health and fitness has been primarily a personal kind of issue. But that's changing, and it's changing rapidly. And health and fitness is going to have a focal point in the workplace. Now, why do I say that? Well, if I go out and I buy a fitness band like this, well, at the end of the month, I might be a couple pounds lighter. But my wallet is going to also be lighter because I had to pay for it. But what if my employer or my health insurance company or my healthcare service, what if they buy hundreds of those or thousands of those and they give me one and I use it and I get healthier? They're going to see more money in their accounts at the end of every month going forward because it's going to cut down healthcare costs. So companies save money naturally through lower insurance rates or if they're self-insured through lower healthcare costs. But there's other benefits to the companies as well. For example, they're going to have increased worker productivity. They're going to have lower absenteeism. They're going to have higher employee engagement and higher employee retention because it's going to be a nicer place to work. So the way they usually get to this is through an employee exercise incentive program. And they'll usually set up goals like number of steps taken or number of minutes spent exercising or number of pounds lost. While we're on the subject of number of steps taken, let me just ask you, does anybody know what the typical target is for steps taken in a day?
10,000.
10,000 steps. That's right. Now, do you know where that comes from? It does not come from any scientific study. It actually dates back to 1964 when Japan was hosting the Olympics. And the government wanted to take that opportunity to help their citizens be more healthy, make healthier choices. And so they marketed a pedometer that you clipped on your belt, a little mechanical device, and it counted your steps. And they called it a man-po-ke, which translates to 10,000 step meter. Now, the 10,000 is a lucky number in Japanese culture. It's an auspicious number. And so this arbitrary number that was just pulled out of thin air because it was a lucky number is the number that we're now using as a target to this day. When I work with companies to help them figure out how to run their own employee fitness incentive programs, one of the things I do is I point out to them just how great the return on investment is for a healthy company. And there are just tons of examples of this, of companies that are already saving money. For example, in Dayton, Ohio, the Regional Transit Authority started a program for their 650 bus drivers. They managed to save $2.3 million a year through an incentive, health exercise incentive program. That's about a third less than they were spending before the program, which is a huge return on investment. Another company had 200,000 employees. They managed to get 1,000 of them to enroll in a fitness incentive program. As a result of that program, they managed to cut their healthcare costs by 25%. They ended up saving about $1,100 per employee, over $1 million a year. And if they could have gotten the whole company to participate and gotten similar results, that would be worth more than $20 million per year in reduced costs. So that's a pretty good return. Finally, another study that was published in the Harvard Business Review reported a company got $6 in savings for every $1 they spent on their program. 6 to 1 return on investment. Pretty attractive. So how many here would like their employer to save 25% or more on their healthcare costs? Yeah, me too. So let me ask you, are you now thinking a little bit differently about healthcare and its future? Do you see how this is going to have a major impact on the budgets and the lives of people, not just in the US, but worldwide? Let me just give you one example to think about. What if we could reduce the cost of diabetes in this country by just 1/3? That's $100 million every year. $100 billion every year. Now, what can you do with $100 billion? To put it in perspective, that's enough money to pay for a 4-year college education for 750,000 students. So, health technology is going to lead us safely through this minefield of healthcare. It's going to save money, it's going to save lives, and it's going to give a better quality of life for us all. Thank you. Thank you.